Okay, so first thing I'm going to do is I'm going to verify my hospital policy and my order. All right, and now I'm just going to go ahead and wash my hands. All right, and verify the order and Mr. Jaguar Jones's bracelets. Mr. Jaguar J. Jones, Mr. Jaguar J. Jones. Date of birth 8/25/1963. Date of birth 8/25/1963. Allergic to penicillin. Allergic to penicillin. Is there anything else you're allergic to, Mr. Jones? All right. So now I'm just going to go ahead and raise the bed up and lower the side rails. Mr. Jones, I'm going to be doing your central line dressing change, okay? And so now I'm just going to go ahead and palpate over the dressing. I'm going to be looking for any redness, tenderness. I'm going to be looking for any pus. All right. So now that I have done that, I'm just going to go ahead and put on, actually I'm going to gather up my supplies first, and then I'm going to position the trash can, and I'm going to wash my hands. Now I'm just going to go ahead and put on my mask. Oops. Normally I wouldn't drop my mask. I'd put on my mask and then my goggles. And then I'd help Mr. Jones put on his mask. All right, and then I'm gonna go ahead and put on my clean gloves. All right, and I'm going to remove Mr. Jones's dressing. I'm going to stabilize the catheter, and I'm going to move, take the tegaderm off, pulling towards the injection site. Okay. And then now that I've done that, I'm just going to go ahead and observe the skin. I'm going to be looking for any signs or symptoms of complication, and I'm going to take my gloves off, glove to glove, skin to skin, with the dressing inside. Okay, and so now I'm just going to go ahead and wash my hands. I'm going to open up my central line dressing. Take this out, place it on the bedside table, throw this away, move this out of my way, and I'm just going to go ahead and open this. Making sure not to go over the 1-inch border, and anything hanging off is unsterile. So I'm just going to move this over a tad. Alright, and so now I'm just going to go ahead and put my sterile gloves on. Alright, and now I'm just going to go ahead and put my right glove on, and then my left. Alright, so now that I have that on, I'm just going to go ahead and organize my area. Alright, and so now I'm just going to go ahead and I'm going to open up my, if I was taking a culture, I would do it before I cleaned. I'm going to go ahead and open up my alcohol swab. I'm just going to throw that over there. And I'm going to contaminate this one hand, and I'm just going to clean the site in a circular motion, making sure not to go over the places that I've already cleaned. Alright, and I'm just going to throw that over here as well. I'm going to go ahead and making sure not to cross-contaminate. Grab my chlorhexidine, activate it, and I'm going to clean in a vertical way, and then a horizontal. And then I'm going to clean the underside of the catheter, the central line and the hub. Just going to clean and make sure everything's clean and thread that away as well. I'm going to go ahead and get my bio patch, which I just put my whole arm over the sterile field, and I normally wouldn't do that. So I'm just going to go ahead and grab my bio patch out, and going to bend it slightly, and I can do that because I'm sterile, and I'm just going to place it on there. Normally it would just go on there. I normally wouldn't do this. Normally it should just go on. Okay, making sure not to touch the shoestring or the catheter and have the bio patch on there. And now I'm just going to go ahead and grab my Tegaderm. And I'm going to open up the Tegaderm. And I'm going to make sure to place this one over the hub, which is the blue part in this way. And I'm going to make sure that it's tight and it's no air bubbles. I'm going to take the edges off, making sure that the edges still stick. Just going around it. Okay, and so now that I've done that, I'm just going to go ahead and clean off my area and throw all of this away. And I'm going to take my pen and I'm going to do my name, my initials, the date, and the time that I changed the dressing. And I'm just going to go ahead and place this onto the dressing, the Tegaderm, making sure not to place it over the site. And it would normally have my name, the time, and the date on it. And then I'm going to throw this away. Glove to glove, skin to skin. And then I'd go ahead and I'm going to take my goggles off and my mask. Throw my mask away. Assist Mr. Jones in taking off his mask. Throw his mask away. And then now I'm just going to go ahead and wash my hands, perform hand hygiene. And then I'm going to go and document. I'm going to document when I cleaned the my assessment of Mr. Jones's skin, if I took a culture, if there was any secretions. I document the type, the amount, the consistency, the color of the secretions. I document how Mr. Jones tolerated the procedure. I document what the time, the place, and the date. And that's all.